Hi everyone, we are from Group 1. My name is Carol Eklar and my group mates are Deepak Kiro Riwal, Rajwant Kaur, Priya, Jasprit Kaur, Navshiv Kaur, and Ramanpreet Kaur Sandhu. We are going to present about schizophrenia. The purpose and objectives of this presentation is to increase understanding of schizophrenia, which include clinical manifestations and risk factors, facilitate the care needs of individuals with schizophrenia, and determine how their care needs can be met, utilizing the interdisciplinary teams and who will be involved in their care. Determine the accessibility of care and services with schizophrenia in relation to the healthcare system. Explore the social determinants of health related to the condition of individuals with schizophrenia. And lastly, determine the support systems in place when people with schizophrenia are discharged from care. According to American Psychiatric Association, schizophrenia is a chronic mental illness that is characterized by hallucinations, delusions, disorganized speech, difficulty concentrating, and reduced motivation. The risk factors include genetic, environmental factors, and life stressors.
Hi, my name is Priya and I'm going to describe the care needs of people with schizophrenia. The first point is that regular physical health monitoring is needed when caring for patients with schizophrenia. Schizophrenic patients are at risk for developing cardiovascular diseases due to the effect of antipsychotic drug and the lifestyles. The focus care on people with schizophrenia is also cardiovascular disease prevention and treatment and healthy lifestyle. Second one is that routine screening of patients with a manifestation of psychiatric symptoms because other symptoms overshadows the presence of psychosis. Third point is that the important treatment in patients with schizophrenia is through medical management. Antipsychotic drugs are used to effectively control acute exacerbations of psychosis and prevent relapse of positive symptoms. Last but not the least, refer the patient to the psychiatrist to obtain definitive psychiatric assessment and treatment in outpatient situations where timely psychiatric referral or consultation is not readily available and no acute safety concern exists. The primary health care provider may elect to start an antipsychotic medication after ruling out medical causes and while awaiting definitive psychiatric assessment and treatment.
The next presenter is Navshiv Kaur. She's going to present how the care needs of people with schizophrenia can be met utilizing the interdisciplinary teams and who will be involved in their care.
The interdisciplinary teams who are involved in the case are as follows. First is the psychiatrist. The psychiatrist is responsible for psychiatric assessment, diagnosis, initial and ongoing treatment planning, prescription of psychotropic medications. He meets with the patient for the evaluation of medical treatment given to the patient. Second is therapist. A therapist works with people with schizophrenia who could be surrounded with the stresses in a sportive way. The therapists utilize a more structured psychotherapies such as cognitive behavioral therapy to help the patients develop coping strategies and approach for limiting the impact of negative symptoms or psychosis, which may persist despite optimal medication management. Third is the case manager. The case manager coordinates the medical services and the treatment plan a person with schizophrenia to the interdisciplinary team. Next is the nurse. The nurse coordinates the health care and the support services in all kind of settings, most especially in the community. And the last is the legal guardian, a court-appointed individual who helps with the medical decision by acting in the patient's best interest when the patient's illness affects his or her decision-making ability.
The next presenter is Ramanpreet Kaur, and she's going to discuss access or lack of access to healthcare.
The lack of access to healthcare. According to Canadian Mental Health Association, limited access to healthcare is one of the significant issues that people with schizophrenia in Canada is facing. Some community-based services considered essential for recovery, such as prescription drugs, psychological services, are not publicly funded. The barriers in accessing to health care of schizophrenic patients include poverty, stigma, lack shortage of mental health professionals, and integration between mental health and health services.
The next presenters are Jasprit Kaur and Rajwant Kaur. They're going to discuss social determinants of health.
Social determinants of health. The concept of social determinants of health has a great impact on schizophrenic patients. Social determinants are accountable for the health disparities and health inequities. The social determinants that the schizophrenic patients face are poor and low educational attainment, social exclusion and discrimination, inequality in income and poverty, deprivation from neighborhood, insecurities of food, insecurities of job and unemployment, instability and lacking housing qualities, insufficient benefits of healthcare and adverse aspect of the environment. The other is social and community context. Schizophrenia not only affects the patient but also their family members, friends, and society. The symptom of schizophrenia seems strange to the people who are not well known with this illness. Some symptoms of schizophrenia are hallucinations, delusion, thought disorder, and movement disorder. Meanwhile, assistance, support, and help from the family members and friends are prime for the good health and well-being of schizophrenic patients. The other is health and healthcare. According to World Health Organization, more than 69% of schizophrenic patients are not getting suitable care, and 90% are left untreated, who live in low and middle income countries. This is due to lack of access to mental health services.
Economic stability. As economic stability is main component in life in order to meet rudimentary needs such as food, house, clothes and healthcare needs, the individuals who are suffering from schizophrenia has less job opportunities owing to impaired thinking and speech process, and it imbalance their economic status and lead poverty, unemployment and poor health conditions. So next is education. Schizophrenic patient has impaired thought process and shows less interest in education and attain knowledge regarding health, which deteriorate health. Next is neighborhood and built environment. The society and surrounding environment is considered as an important factor for growth and development of an individual. The society looks at schizophrenic patients as a social stigma and does not support and accept that people with mental illness, which leads social isolation and put impact on physically, mental, and social well-being of an individual.
The last presenter is Deepak Kirariwal. He's going to present support systems in place when people with schizophrenia are discharged from care.
Support system in place for when people with schizophrenia are discharged from our care. Connecting with the community will be a contributing factor to the health of people with schizophrenia. Start trusting family members and friends and reach out to them who can understand them. Family support is very significant to their health and well-being. Peer support groups. There are online and in-person group, namely National Alliance on Mental Health Illness and NAMI Connection, which is a recovery support group and educational program made for individuals with mental illness.